Hi, everyone. My name is Allison Metz, and I direct the National Implementation Research Network at the University of North Carolina at Chapel Hill. I'm excited to talk with you today about how implementation science can advance equity. I'm joined by Anna Baumann, an author of the SSIR article, Equity in Implementation Science is Long Overdue. In this article, Anna and her co-author, Denise Long, describe the work implementation science needs to do as a field to advance equity, particularly for historically underserved populations. Anna, would you like to introduce yourself and also say a word about your co-author who is not able to join us today?
Yeah, I'm Anna Baumann. I am a research faculty at the Brown School for Social Work at the Washington University in St. Louis. I am also the co-director of the Dissemination Implementation Research Core, a methods core from the Institute of Clinical and Translational Science at WashU. Pamela Denise Long is an instructor at the Southern Illinois University and a Doctor of Education candidate in Organizational Leadership and Development. Her consulting and facilitated training focuses on the intersections of leadership, trauma-informed care, and implementation of racial equity by way of anti-racism. Her emphasis is on the outcomes of multi-generational Black Americans.
Great, thanks so much, Anna. So I'm going to kick us off with our first question. So the article that you and Denise wrote speaks directly to implementation researchers and implementation practitioners. Very briefly, what are the high-level things you think these two groups need to do and be engaged in order to advance equity?
Yeah, so we believe that implementation researchers and practitioners need to develop a consistent focus on equity as they develop knowledge, select interventions, and use implementation strategies. We can only do that by integrating the voices and wisdom of those historically oppressed communities. We need to reflect on our values and our behaviors as implementation researchers and practitioners.
Thank you so much. It's a really helpful frame as we start the conversation off today. In this piece, you and your co-author Denise Long write that we, quote, must critically assess the gaps between the intentions and impact of our work. Can you tell me a little bit more about what you mean by that?
The field of implementation science was born to decrease the quality gap, right? But equitable implementation means examining the social justice of our work and aiming for fair, restorative, and equitable outcomes. As such, we propose that we have to truly engage in equity work, meaning the interventions and their strategies must address social determinants of health. Those are a broad range of social, economic, political, psychological factors that directly or indirectly shape our health and contribute to health disparities. Underlying that is the assumption that health is not the absence of disease. Health is the presence of resources that support people to thrive.
Thank you so much. In the article, you talk about the COVID-19 pandemic and use that as an example. Can you talk a little bit about the takeaways around COVID-19 and implementation and what that can teach us about advancing equity and where we need to go from here?
COVID-19 make disparities explicit more than ever for all of us, right? We've learned that when added to masking and hand washing, social distance is an effective evidence-based intervention for respiratory viruses, right? But if you consider social distancing as an intervention, what happened was, if you don't examine context, it has negative aspects. For example, school shutdowns have exacerbated pre-existing inequities in education, and also limiting social context for children that need for their development. It has taxed household resources. Since social distancing began, we've seen data that depression and traumatic stress responses have increased. Those are mental health effects that we might see even after the pandemic. Social distancing is affecting businesses, especially small businesses. So in one way, social distancing saves lives, but it also exacerbates inequities. Consider, say, Black communities. In summary, COVID-19 has disproportionately affected vulnerable populations.
Thank you so much, Anna. It's really is a great example as we think about implementation equity, and just ask you to reflect just a little bit more around what you've learned through the pandemic about equity and implementation.
We talk about social distancing working best for populations that are able to work from home and that have access to remote learning. Acknowledging and addressing the collateral consequences of an intervention is only a part of what we need to do. We need to generate equity healthcare. The compounding effect of this pandemic has opened our eyes, and so we hope that moving forward, we can do more equitable implementation.
Yeah, thank you so much for that reflection. In the paper, you and your co-author issued 3 calls to action for the field. So I wanted you to talk a little bit more about those calls to action and what implementation researchers and practitioners can do, and how you arrived at these 3 specific recommendations.
Yeah, we talk about the development of equity-focused evidence development, intervention selection, and outcome measurement, and implementation strategies. So let's go for call for action 1. Engage with historically underserved community members and collaborate with other disciplines for evidence development with equity at the forefront. What does that mean? It means that we need to reflect critically about the unintended consequences of our work as implementation scientists. We were just talking about social distancing. Mm-hmm. We need to examine and understand the role of social determinants of health, the political, social, historical dynamics of the context in which we're implementing our interventions. We need to count and account for the deep, prolonged history of white supremacy, systemic racism, and other forms of discrimination in which our populations have been suffering. We need to acknowledge the ways that our organizations are shaped by cultural and historical aspects. So what we need to do is examine how even our questions, our research is tangled with power, perspective, and identities of our academic relationships. To do that, we need to also examine how are we developing the interventions? How is the evidence of the evidence-based intervention has been developed, collected, examined, who is doing all of that, and why? Without intentionally examining all of these, we might actually be perpetrating inequities in care. So we advise our implementation science colleagues to really sit down and think about how equity can be placed at the center. How can they engage with a whole lot of literature that has been doing equity at the forefront? Say, community-based participatory research, community-engaged research, critical race theory. The goal here is not to develop new jargons, but really learn with other fields that have done equity work. Call to action 2. Pay attention to the intervention selection and measurement by which you're doing social determinants of health. So evidence, right, informs intervention selection. As you select your interventions, there are some interventions that might be useful when you think about social determinants of health. We've been thinking in implementation science for short outcomes, right? Say social distancing for respiratory disease. Maybe we should think about going further than proximal outcomes and thinking about For example, the impact of social distancing in small businesses. What is the impact of our interventions in social determinants of health? Or the other way around. What is the impact of this intervention on our proximal outcomes? Call to action 3, develop implementation strategies. As we advocate for implementation researchers and practitioners to consider social determinants of health, we need to think about the strategies accompanying those interventions. So maybe we should think about system level strategies that enhance equity. We need to think about how to attack or understand and examine social, economic, historical, political context. Equity-focused implementation strategies need to ensure that those from underserved communities are not blamed or deemed to have a character deficit. They need to bring trust, safety for our communities. So with that and with justice in mind, we need to develop strategies that are not only to meet immediate needs, but to rectify the consequences of our system.
Thank you so much, Anna. What I love about those 3 calls is they are actionable. And you did just such an incredible job explaining them and walking through them. So thank you so much. So we've come to our last question for today. So what do you think are some steps that people listening to our conversation can take right away to get started on these calls to action? And what are some questions they might ask themselves about their work?
We think that we need a major shift in our current academic model. Because what happens is we're not going to be able to tackle inequities in healthcare with one funding at a time, with different fundings, right? We need to build a collaborative practice with thoughtful sharing, thoughtful resources, and very deliberate capacity building. We're building a next generation implementation science, right? So the next question is, how can we as a field be held accountable for equity work? So we pose more questions than answers, I guess, right? How do policies impact the reach, implementation, and recruitment of the population, underserved population in your studies? How might you develop strategies that can affect the contextual issues that contribute your disparities in your outcomes? How might you ensure accountability and self-reflection as you do this work? How might you embed anti-bias, anti-racism training in our several implementation science trainings and strategies? So there's more work to do. There's a lot of work to do, and we're very much looking forward to the next generation of implementation scientists.
Thank you so much, Anna. Thanks to you and your co-author, Janice Long, on this article. And thank you so much for spending just a little bit of time with us today and kind of walking our listeners through that article and really bringing it to life for everyone. So grateful for you. Thank you.
Thank you.